This is Robert Davis again. This is another one of my patients. You're at Coastal Dental Services Dentures and More, and you're seeing another example of the implant retained denture. This case is a little unique because this young man came to me after having had 2 implants placed by a oral surgery department at a local hospital, where he was told he did not have enough bone to put 4 implants in. Came to see me to have me convert his denture to attach to those 2 implants, which we did. And I told him at that time that the protocol is to have 4, and the reason for that is because the denture will rock over those 2, sort of like a teeter-totter. We looked at his x-ray and examined him and found out that we do have enough room for 2 more implants, and that I did, but I had to use 2 different kinds of implants than the ones originally, because the ones originally were too large for the amount of bone he has. Now I'm going to ask my assistant to take a picture of the video, which is right there. She will scan that over to the video, and we'll show you the x-ray on the video, and I'll explain the 2 different kinds of implants. The 2 big ones are a standard type of an implant, and you can see they take more space and need more bone than the others. Sorry. And the smaller ones are narrow diameter implants. They're not many implants, but they're narrow diameter implants, and they're designed specifically for cases just like this, because the x-ray reveals that he has a very small lower ridge. And that's why we use the narrow diameter implants, because we can put them in ridges where there's otherwise not enough bone. Anyway, the result of this is now we have 4 implants in there, which is the protocol to stabilize the denture without it moving a bunch. So I'm going to let him talk a little bit. We're going to let him smile into the camera. Eventually he'll take the denture out and he'll tell you his thoughts and his feelings about this. So you're on.
Well, I just wanted to thank Dr. Davis, because he did what others either could not or would not do, which is to allow me to have a stable denture that doesn't press on my gums, doesn't hurt when I chew, and allows me to smile. I spent more than 50 years with ill-fitting dentures. If you have the opportunity, I would suggest that you come to Dr. Davis to see if he can't help you. He's helped me, and I thank him so very, very much.
Tom, I appreciate that. That's very nice of you to say. But let me straighten a few things. He said he wore dentures for 50 years that were ill-fitting. That's not really the problem. They may not have fit real well, because after you wear a denture for so many years and the gums begin to shrink and change, that it doesn't fit as well as it should. The problem is the morphology, which is the size, shape, and function of the lower ridge, is not conducive to supporting a lower denture. This is why so many people say, my lower denture's loose, it doesn't fit, it won't stay in. What can you do? Most people think, well, I just have to reline it and it renews it. A reline is not a renew, because your jaw has changed. And what we do is we put the implants in to use as stable anchors to stabilize and retain the lower denture. In this case, we're using a removable technique, because a removable technique, first of all, is a lot less expensive to do than the all-on-4s, the hybrid bridges. It looks just as good and it's just as functional, yet the patient can take them out and clean them. And this is what I recommend to my patients, to take them out and clean them every night. And I want him to show you his smile. I want him to show you how he removes them, and then we'll zoom in on his mouth so you can see the actual tops of the implants, which are the abutments. These are a different piece that are screwed onto the top of the implant. These are the abutments that help retain the denture. Okay, so now you're on again. You go ahead.
Okay.
Give him a big smile. Okay.
I'm not used to it because I haven't done it in 50
Sorry.
years.
We'll tell you a joke. You could smile real big. All right, do me a favor then. Do the lower dentures stay in? Do they come out when you don't want them to come out?
They do not.
Okay,
They
so
stay in.
so you can function, you can eat. Does food get underneath them?
Not normally.
It's okay if a little food gets underneath them, because once again, the only difference here is this is a removable, so there is a little bit of movement in it. And when you chew, you can have some movement, get a little food in. The nice thing about that, you go right to the restroom right there, and clean them out, put them right back in, you're good to go.
I get a little bit of potato chip or something
Yeah.
underneath it, and I, like you say, I
You get a
to the
potato chip
restroom
underneath
and-
it, it hurts, doesn't it?
Aggravating,
Yeah.
right?
So
I would
you gotta
assume
rinse. Okay,
so.
I'm gonna go ahead, take them out. Now listen for the pop. Okay, now let's show them what we have here. You can see we've got two over here, two over here. This one is just a black transfer cap because I just put this cap in and I want to leave it in this temporary cap for about 2 or 3 weeks until we make sure it's all right. Now then, let me show you in his mouth. Get real close here. All right, we've got 2 different kinds here. We've got the kind with the little golden colored tops. Those are called locators. That's the standard abutment that we use for these. This is a different kind of a top. This is made by the same company that makes the locators. This is what's called an RTX, and this is a regular locator. This is just an enhancement of these kind. They're a little more expensive, but they don't go on the implants that hold these. So that's why we have 2 different kinds of implants, because you can see there's just not much bone there. You can see by the x-ray that the bone was small as the little finger. Now I want you to put them back in. Okay, do you feel it snap in?
Snap
Okay,
in.
now then, let's try a little trick here. I want you, without using your hands, to get that lower denture out. Okay, you popped it out there, but he had to make a concerted effort. Let's take it out again. I want to show you something. The reason that he's able to get them out is because all the implants are up front, ostensibly in a straight line. So we don't have 2 here and then 2 back here because we don't have enough bone. And that allows him to get his tongue up underneath here and push it out. But when he's eating, he's trying to eat my fingers.
It's fine.
Okay, when he's eating or talking or singing or speaking, they will stay in. And that's what we wanted to show you. So anything else you want to say?
Just thank you.
You're welcome. You're
Yeah.
welcome. Okay, thanks a lot.